Good morning, and thank you everyone so much for joining us this morning, for all the stakeholders on the call, for the folks watching at home. My name is Vanessa, and I'm one of your Peekskill City Council members. I'm very excited to be here with you this morning. I hope you all are finding yourselves well and that your families are healthy. We are here to convene I believe week 4 of our weekly Peekskill Community COVID Updates call. The purpose of these calls is to create a space for community leaders to convene in a COVID-safe way, with the intention of helping members of the public to understand and support efforts to respond to the coronavirus crisis by providing weekly updates from key agencies, including ways that we can all pitch in and lessen the burden. Now these calls are happening on a weekly basis. We broadcast live here every Thursday at 9:30 a.m., broadcasting live from our City of Peekskill Facebook page. This video is later on published onto our city website, as well as broadcasted across our government channel for folks who may not be online to also have the ability to tune in. The intention of these calls is really for us on a weekly basis to rotate through different stakeholders to give the public the ability to hear from a variety of agencies as well as from different departments here in City Hall. But today we will be hearing from Reverend Phillips and Ben Bolton, who will be giving us updates from Hudson River Healthcare. One of our Peekskill nurses, Joanne Boniello from Hudson Valley Hospital. We have our Assistant Superintendent of Peekskill School District, Dan Callahan. We also have Joyce Cuccia from our Peekskill Parks Department joining us, Reverend Graham from our Peekskill Area Pastors Association, Cynthia Knox from Caring for the Hungry and Homeless of Peekskill, and last but not least, we have Andy Stewart, our Peekskill City Manager. So I will hand it off to our Mayor Rainey to give us some welcoming remarks. Mayor, thank you so much for being here this morning.
Yes, thank you as well. Good morning, everyone. I'll make it very brief. I know a lot of you have a lot of things to say and a lot of things to do today. But thank you again for being a part of this phone call. Some of you, this isn't your first time, so thanks for returning and joining us again. For those of you who joined us for the first time, we really, really appreciate it, and we look forward to hearing the information. To everyone, again, just want to remind you all for sure, this meeting will be posted on the city website, on the city Facebook page, as well as the city government channel, just as well as more and other information that you may be looking forward to or be interested in looking into. So please continue to check the city website. Continue to check the city government channel as well as the city social media page for those of you who are active on social media. We have plenty of information that is coming almost daily from the stakeholders calls, as well as other calls that we're on with the county, with the Department of Health, with the school district and youth borough, and other mayors from towns and different towns and cities and villages as well. So thank you all for tuning in. I look forward to hearing some of this information and how the city can continue to support. And I just remind everybody, please continue to practice social distancing and be safe out there.
Thank you so much, Mayor. So we'll go ahead and jump straight into our agenda. First up, we have Reverend Phillips and Ben Bolton from HRH Care. Thank you so much for joining us, Reverend Phillips.
Yes, and good morning to all. I would like to just, again, thank all for their support as they're going forth with our advocacy program, because we know that once we share with our legislators and they're able to do the funding, make the funding mechanisms come forth for community health centers overall. We're also pretty much in, the governor's office is pretty much in contact with us at Hudson River Healthcare throughout all the sites, because as different programs come up, we're able to help support. And the star in that is the fact that Hudson River Healthcare, which our base, if you will, is in Peekskill. And that allows them to know that Peekskill is in it to be able to help throughout the state in terms of where our community health centers are housed. This afternoon, I'd like to remind you that from 1 to 2, We have the town hall meeting. The one that we held last week was very, very successful. And this week we're doing it in Spanish so that all of our constituents that are here in Peekskill are able to understand where things are going in relation to COVID-19. And so we have Dr. Yarbe, who will be leading off for our medical team for this afternoon, and Myrna Handelman, who does a lot of our community outreach, will also be another participant in that town hall meeting. At this time, I'd like Ben, who has a lot of the statistical numbers that most of us would like to hear and see how things are progressing. Ben, if you would share now.
Thank you, Reverend Phillips. And again, we just really appreciate all the work that the city has done in supporting us and in supporting the community and making the town hall possible last week and this week. It's critical that these outreach efforts continue, and we couldn't begin to think about them without the cooperation of the city. So thank you again for that. We're seeing changes in the progress. The governor's pause order was set for May 15th, and there's beginning to be some regional planning for reopening. A lot of that is based on availability and demand and hospitalization. There are 7 criteria. You can see them on the governor's website. Westchester County is still rather, out of all the criteria, our region only has about 3 of the 7 criteria met. So we're probably going to be seeing some of the northern regions opening first, the less densely populated, and there's a whole set of criteria around that. Right now, New York has tested over 1 million people. That works out to be about 21,000 tests per day. The criteria for testing is opening up as more test kits become available. And certainly, Hudson River Healthcare has a number of testing sites in the Hudson Valley. And if people are concerned about testing, they can contact HRH Care. There's a process where one of our nurses can screen the call for criteria, and then they can set up a testing appointment. We're seeing in Peekskill so far a total of about 740 COVID positive tests since the pandemic began. Right now, the data we show is about 188 active cases. There's been some work through the governor's office on a small sample of antibody testings, which are showing people who have produced the antibody. And in Westchester, that accounts for about 13% of the population. I would caution people that it's still not clear what having that antibody means relative to immunity. There's a great deal of epidemiology going on right now to better understand that. On a positive note, as you may remember, when we started this 4 weeks ago, we were seeing hospitalization rates against testing that up to about 10% of the tests required hospitalization. We're now down to about 3%. So as the demand on hospitals has diminished, and also as people are understanding and learning more about the path of the virus and how to treat it, those hospitalization rates are decreasing, which is a very positive sign. But, critically, I think as the mayor and everyone else has mentioned, for now, social distancing is the best protective measure. And as the governor and the Department of Health work through the pausing of that, there'll be further recommendations. Thank you.
Thank you so much, Reverend Graham and Ben Bolton, for those important updates. And I'm so glad that the town hall last week was a great success. I'm sure that the one later on this afternoon will also be a great success as well. Do we have any questions from any folks on the phone or from anyone watching online?
I'm not seeing any online. I would just like to note one item though, related to the data, and I appreciate Ben Bolton's review of that. It's been confusing, I think, to local residents to just see the cumulative total of cases that we've been able to publish, because that's what we've gotten. We have started publishing a map that the county puts out that does subtract out the resolved cases. So that's how you get from the over 700 positives to the a little less than 200 actives that Ben was talking about. So that's on our city Facebook page, and we'll continue to update that as that map becomes available. But we're not getting that data in a sort of a user-friendly way. So I'm actually thinking of just stopping publishing that cumulative total, because I think it's not clear how useful it is. The active cases, I think, is what we're most interested in. And if you look at the Dutchess County Department of Health's website, they have a dashboard that shows total cases, active cases, number of hospitalizations, number of deaths, and other, which would be useful to have, I think, for Westchester municipalities as well.
And so, Andy, if I could just chime in there, and you bring up a very good point about that ratio between the number of cases tested positive versus active cases, and again, where the science is still being explored and investigated, but there's a very high likelihood that those who have recovered from the disease, meaning the 500 plus of the total number of cases, that they've now been imparted with some level of immunity. The nature of that immunity is not understood, but that recovery rate does help understand return to, or the lightening of the pause, and that's one of the factors that'll be interpreted by the Department of Health and the governor's office.
Well, thank you so much, and I for one want to say give you both a special thank you, because you both have been committed stakeholders that have been on this call week after week after week. So I really do appreciate you both taking the time out of your days to prioritize this call, to share this very important information to the residents. I know it's providing so many of us so much clarity, and the one way I think we can combat all the fear that is spreading is with knowledge. So thank you so much for being a part of that, and thank you for all the hard work you're doing to keep our community safe and aware of everything we need to know in terms of how to truly combat this virus.
Good, because we're in it together.
Absolutely, absolutely. Great. So if there are no other questions, we'll move on to our the next individual on our agenda. Joanne Boniello, thank you so much for joining us. For those of you who may not know, yesterday was National Nurses Appreciation Day, and we very much appreciate everything our nurses are doing by being on the front lines of this pandemic and truly putting their lives on the line to serve the duty of their jobs, which to them may not be so much to ask for, but in these times, it really, it's at the foundation of our society in terms of what our healthcare providers and services are doing, taking care of our communities. So we really appreciate Joanne and all the nurses at our hospitals here at the Hudson Valley Hospital, and we appreciate you being here to share some updates from what you're seeing on the ground over at New York Presbyterian.
Well, thank you very much. So I guess what I can tell you is we definitely have seen a decrease in the amount of COVID patients that we've had over the last few weeks, which is great. I am concerned about when we reopen that people might start to get a little lackadaisical and we're going to see it all over again. You know, I have relatives down south that are already going out to diners. You know, they don't see what's going on, and that scares me. It worries me a little bit, which I'm sure it does with everyone. You know, to echo what Ben said, yes, the numbers are going down. I don't think we know enough about this yet. There hasn't been enough research. You know, it's a new pandemic. I know I've seen people that have had a false negative test and then turn out to be positive later down the road. So that's where we all just need to be really careful. The social distancing. We were talking at work the other day. We're like, what has changed to make our numbers go almost in half? And basically, it's the social distancing. We haven't come up with any, you know, wonder drug that's going to keep us all immune from this. It's just really that we've been more careful. And we need to continue that until we really understand this whole epidemic. So that's where we are. We're all holding up. I mean, we're all, you know, in it for our patients. We don't think about it as, you know, we're not going to take care of this patient because of, you know, whatever. We're there to do our job and to care for our patients. That's why we're nurses and healthcare workers. I don't know if you have any questions for me.
Did you want to share a little bit about what the conditions are at the workplace in terms of are you seeing a lot of patients? Are nurses being overwhelmed? Is there a certain time of the week that you see a lot more activity than others?
I work the night shift, which is from 6:30 at night to 7:30 in the morning. During the day, because there's no OR cases right now, unless they're emergent. We have the OR nurses, we have the PACU nurses, we have extra staff from those departments, ambulatory surgery. So I'd say 99% of them, all of them work day shift, but they've asked a few people to come on nights. But we really haven't gotten a big surge of that extra staff on nights. So during the day, they do have a lot of extra staff to help out. At nighttime, we do have travelers because we still are short staffed to begin with before this pandemic started. So we do have some travel nurses that come in, and definitely more on days. Days is great. You know, nighttime, we still kind of, you know, need staff, but that's just going to happen. We were definitely overwhelmed a few weeks ago. It was rough. Also, as nurses, because we saw this progress, like we've learned what we need to do for our patients. We didn't know in the beginning, like we didn't know how this whole thing was going. You know, it was interesting, like taking notes, like this person had this and that person had that. And so now we kind of put the pieces together. So we know how to watch to see if our patients are declining, because they go fast. And I don't work in the ICU unit or PCU where people are intubated, but I'm on a med-surg unit where I might have to call it to get that patient, you know, to the ICU, you know. So it's, you know, it's gotten a little bit easier because we understand more. So I believe at the peak of this whole thing, we had like 95 patients in the hospital early April. Now we're down to about half of that are COVID positive, and you know, and that's hospital wide. As far as our PPE goes, I know that was a big thing in the news. We've been pretty good. The only thing is the N95 masks, which there's been from the beginning, because we didn't understand everything. They were like, don't use the mask, use the mask. It's this whole thing. But anyway, we're given one per day. Unless it gets really soiled, I guess you can get another one. The testing now, we have, we're working with our union, which we don't have a contract with yet. We're trying to get a contract settled. Now it's hard because we can't meet face to face with anybody, but they are testing people now if they request it. Before they wouldn't unless you had symptoms. But you can be asymptomatic and still test positive, and so we're worried about that. So the union the company has said that yes, we can get tested now. So, but I see it improving. But like I said, I'm very worried. We all are, that we're going to see a resurgence of this quicker than we expected. Because I understand people want to get out there. I understand, people have to work. It's just on my end concerning.
Absolutely, because
this is Ben Bolton with Hudson River, and I just wanted to really echo and support that, that this is a marathon. This is not a sprint. There's a lot we don't know about it, and all the evidence is real. We're learning every day, but as social isolation is relaxed, there's an inevitability of increases. And so managing those expectations and balancing those with those needs to return to work is a really critical part of this.
I totally agree with that, Ben. It's, like I said, it's a little scary because I do think that if people don't see it, they think, oh, everything's okay. It's just, we just don't know enough about this. There's not, it hasn't been around that long, and the social distancing right now is the biggest part of what we need to do. So.
I have a question from Facebook, if I could. Mm-hmm. The question is, and this might be both for Ms. Boniello and for the HRH, but they're interested in the demographics of infected individuals. Specifically, are they mostly essential workers or people who are actually staying at home is the question. Mm-hmm. But the demographics of infected people.
I don't have any data on that. I don't know if Ben does.
We do have some, and again, I would caution everybody around data. There are a number of really robust sources out there, out of Johns Hopkins, out of University of Washington. But a lot of the data is very new. A lot of the sample sizes and the way the data is interpreted from a statistical point of view is still being figured out. So, what we are seeing is that, and I just have some of the fatality data. In New York, about 14% of the Hispanic population, 9% of the African American, New York statewide population. Right now, Caucasian is a high percentage rate, but these are ratios of numbers of the overall. What we are finding is that age definitely plays a significant factor. We're seeing 26% of the 70 to 79 age group has a mortality rate, and 25.4% of the 80 to 89. So age is a significant issue, and what we're also finding is what are called comorbidities, which are other pre-existing medical conditions that make people at higher risk. And those include things like COPD, cancer, stroke, diabetes can all escalate the risk. So there's a difference between mortality to hospitalization to just being having the disease in the system. I think there's a lot of data coming out showing that a lot of people have actually had it, but they're asymptomatic. You may not even know that you have it, or you may just have a scratchy throat. What we do know is that density of your living conditions or in your exposure to other people increases your risk. It's still a very highly transmittable disease. And so that's again why isolation is the most robust form of protection against the spread and contagion.
Right. And at the hospital, I mean, we have seen, I don't have any numbers for this. I'm just telling you what we've seen. There are many Latino people. And I think because they do live in close quarters, I mean, that's just my opinion. But also, we were surprised in the beginning that it wasn't more hitting, I guess, the word, I don't know the right word, but the elderly population. I mean, we've had people from their late 20s to like early 60s that were, you know, boom, they're declining and they're intubated. And, you know, it's not a geriatric, you know, virus. It can hit anybody at any time. Of course, if you have, you know, more comorbidities, that's not great. But, you know, the other thing is what we've seen, and what is difficult is that, you know, if people are elderly, and actually everyone should have this conversation before you ever get sick. Do you want to be a DNR? Do you want to be intubated? That's a big question. And when someone's in the hospital, to ask them at that point, that's really difficult. So we do have people that if they are a DNR, they don't get intubated, which sometimes, you know, it's quality of life. So it's everyone's own decision. But because of that, we have seen, I'm not used to seeing someone die almost every day. And kind of now we get that, you know, and that's why that social distancing is so important, so important.
And if I could just chime in, you know, the DNR forms, the do not resuscitate, are part of that equation. But New York State, and I would imagine the hospital has these forms, but you can certainly get them online, allow you to designate what's called a healthcare proxy, which is if you're in a condition where, for whatever reason, you can't communicate your wishes around healthcare treatment, you can designate someone to make those decisions for you, and you can limit how and what decisions they are allowed to make. And as you mentioned, whether it's around COVID or anything else, that's a very helpful document to have for just, you know, as one might have other important paperwork, to keep that known and to share that with your provider.
Yeah, you're right. You can get it online, and you can also, they do have them at the hospital, but you know, I've even found with my family, not through this whole thing, but beforehand, we all should have a healthcare proxy, because you never know what could happen when you walk out the door. And, you know, that might be something everybody wants to look into, no matter how old you are, really. We all need to have that. So I think that's.
Thank you so much. Andy, do we have any other questions? Oh, you're on mute.
Sorry. Yeah, I just wanted to say I did get a call from a nurse who was looking for ways of volunteering. She is employed, but she has time in the evenings, and was just wondering whether it's the hospital or the schools or some other agency, if there's any particular way that somebody with nursing skills, I don't know if she's an RN or what level, if there's some group that could help kind of align her with a way of helping out during the health crisis, in addition to what she does during her day job.
I believe New York State does have a clearinghouse online for those, for clinical professionals. But certainly, Andy, if you'd like to talk offline, we can see if there's a way to connect her.
Okay, thank you.
Great.
I just wanted to say one more thing. I know I mentioned it a little while ago, but you know, we have voted in our union, I think last year, and we're still trying to work on our contract. And, you know, we just want to ask, there's been, you know, a little bit of resistance along the way. And, you know, maybe if the community could just write letters or something, just asking, you know, supporting us that, you know, we just want our negotiations. We want to talk. That's all we want to do. Get things set in place. And, you know, and that's what we need from the community. Support us. But maybe that nurse also, there is Fred's Pantry is one thing. Maybe she could, you know, she could volunteer for, because I know they always need help. But anyway, I just want to thank everybody out there for all their support, and we're going to keep plugging on.
Thank you so much, Joanne, for being on the call. And yes, it's very important for the community. I know you probably get asked a lot, how can the community support the nurses? And I'm sure you all love to receive the food that's sent over to the hospital and the thank you cards, but really we want our nurses to be paid well, compensated for their work, and protected. Thank you so much for putting that plug in, and I know that we as a council will do everything we can to support you in that initiative as well. So thank you so much for being on this call.
Okay, thank you.
Great. Now, if we don't have any other questions, it looks like sounds like we're good to go. We'll move on to Cynthia Knox, Executive Director of CHOP. Cynthia, thank you so much for joining us this morning.
Good morning. Thank you. And thank you for switching me around on the agenda because I have to jump off at 10:30. So
yeah, absolutely. Let me know when you want me to start sharing the screen for the.
Okay. I will do a brief update on Jan Peek House first. And I just want to say that extend my thanks for the city and the community coming together in this way. That's what makes Peekskill so special. You know, we may have our disagreements over different things, but at the end of the day, when there's a crisis situation, we come together, you know, the city leadership and the community to work together as a community to move forward. So I really appreciate being part of this community, both as a resident and somebody who works in here. And it's like I said, it's like we have our disagreements. It's like a family. It's a 24,000, you know, family. So I'm just going to briefly update on Jan Peek House, which is our shelter here in Peekskill for homeless adult men, women, and veterans. We're following all guidelines from the CDC for homeless shelters, including maintaining social distancing of 6 feet, ensuring that we have the appropriate number of residents so we can do that in sleeping and throughout the day. We're following rigorous sanitizing procedures. We're fortunate that right now in Westchester County, there's twice the number of vacancies in the shelter system than usual. So that helps us to ensure that we have the appropriate number of clients. No shelter residents and no on-site shelter staff have been COVID-19 positive. And we're very happy about that. I believe that we're the only shelter in Westchester County thus far. And you know, we're going to continue to try and do everything that we can to keep the virus at bay as long as possible, because obviously time is on our side. So that's the update with Jan Peek House. The community has continued to be incredibly supportive. We don't have volunteers coming in right now, but we have people providing meals and they drop them off downstairs, and people are still donating things. We've had a lot of people make masks for the clients and the residents, and that has just been a terrific sense to keep us connected to the larger community. If no one has any questions about Jan Peek House, I'm going to move on to Fred's Pantry. Any questions? Okay, Vanessa, if you wouldn't mind putting up the slides and going to the second slide. I'm going to talk a little bit about Fred's Pantry now. We have staggeringly high need. Can you advance it to the second one? Thank you very much. Okay, so you can see that we really peaked fourth week of April. We provided food to over 500 individuals. And then the first week of May, it went down a little bit, over 400. The average household size is 4 people. Thus, we're providing food for over 2,000 people. We've been fortunate in that we have not had to turn anybody away yet. I'm very happy about that, and a lot of that is due to the generosity of the community. We are working with Jonathan Zamora and Ride Connect of FSW, Family Services of Westchester, to get groceries to homebound area seniors. There is an enormous strain, as I think people are aware, on the food system, especially the local food bank, causing us and others to have to purchase food. For example, we spent $3,000 on meat last week and several $100s on eggs and other items. And again, we've been very fortunate that the community has said, what can we do to help? And they've been donating to help us do that. One of the issues that we're grappling with is ensuring that we have sufficient healthy food. Oftentimes, food that the food bank gets from large grocery chains and large distributors is high in sodium and sugar. And obviously that's not good for people with health conditions, particularly hypertension and diabetes. So we're very aware that the health experts are anticipating that we may have a resurgence of COVID-19 in the fall. So we're focusing on how to ensure that we have enough healthy food to help people build up and maintain their immune systems. So it's about making sure that people have enough food for their families, and it's about making sure that they have the right kind of food for their families. As unemployment increases, some experts are predicting that the unprecedented need for food that we're seeing right now will continue for 18 months. So we're really trying to think about and work with others to figure out how do we do this in a sustained way for 18 months? How do we manage to be able to increase when there's increased demand, and if the demand levels off, go back down again, but then be prepared to come back up. So those are some of the issues that we're working on with others. And the final piece of information that I'll share, and this is some great news, Senator Harckham is sponsoring a food drive in partnership with CHOP. It's going to be Saturday, May 15th from 12 to 2 p.m. at the high school. As soon as we get the flyers and other materials done, we'll be getting information and sharing it wide and far for people. So that's my update on what's happening with CHOP. I'm happy to answer any questions.
Thank you so much, Cynthia.
You're welcome.
Do we have any?
I'm sorry, can I ask one question? What do you think the best way to help? Donating money so that you guys can purchase the food, or going to the grocery store and purchasing it ourselves?
Right now, the two most helpful things, money, so we can purchase, and if people want to purchase the food, that people band together to do it, so they're purchasing it in bulk. For example, the Rotary has been very generous, and a week or two ago, they bought several $100s worth of meat. So purchases in large quantities that are coordinated with us are very helpful, and the financial donations. Because obviously, as we all know from going to the grocery store, the price of food has significantly increased.
Thank you. Do we have any other questions?
There was another question, which is really just how you distribute the information about that food drop-off at the high school, because I see somebody here wanting to know how to drop off food. And
That's great. We just finalized this yesterday, so hopefully by the end of the day today, we'll have flyers and postings on social media, and we're hoping that we might be able to do some radio PSAs. So that's how we'll disseminate the information, and we'll send the information over to the city, and if it's appropriate, to post it on the city website or on the city Facebook page.
And we can definitely add that to our COVID-19 resource doc that we have listed. Great. Well, thank you so much, Cynthia, for all your hard work at Jan Peak and with Fred's Pantry. It's, you know, your organization plays a crucial role in our community, so we really appreciate everything that you and your team are doing.
Thank you.
Andy, do we have any other questions from folks who are watching online? Okay. All right. So next we have an update from Assistant Superintendent Dan Callahan from the Peekskill City School District. Dan, thank you so much for joining us this morning.
Good morning. Thank you for having me. Good morning, Peekskill. First and foremost, I hope everybody is healthy and safe. A special thank you to all the people in the medical field, especially hearing you talk this morning. What you're doing for all of us is greatly appreciated. This is also actually Teacher Appreciation Week. So I want to take the time to thank all the staff and all teachers everywhere for everything you're doing for our students. Things have changed in the education world, and I think teachers have adapted very, very well. A couple of announcements from the school district. I think obviously by now everybody knows last Friday Governor Cuomo shut down the schools for the remainder of the year. So we will continue with our remote learning opportunities for all students. Any students in Peekskill that might need an electronic device, Chromebook, tablet, something like that, you can come over to Uriah Hill Elementary School on Tuesdays and Thursdays, and you can sign out a Chromebook that you can have for the rest of the year. All we ask is everyone take care of it, because we will be collecting them back. Hopefully we'll be able to start seeing students face-to-face maybe in the summer, if not, hopefully in the fall. As part of Teacher Appreciation Week, there will be a special car staff parade going on actually today. You know, we miss our students so much that we have approximately 100 cars that'll be going around Peekskill today. They'll have all different staff members in it, principals, teachers, teaching assistants, teacher aides. So if you want to come out and show your support for the staff, or just to see some of your teachers, we'll be driving around starting at 11 o'clock from Woodside Elementary School. And then we will go school by school. We won't be able to hit every single road in all of Peekskill, but we'll be driving around the neighborhoods where all of our schools are, starting with Woodside. We do ask everyone to keep social distancing. You know, you can wave from your windows, maybe stand on your front porch. And if we don't get a chance to see some of you today, please know how much we miss everybody, and hopefully we'll be able to see everybody soon. I know a big question that's coming up at the end of the year is, what are we doing about graduation? Obviously, a lot of schools are battling, you know, what to do with their graduation ceremonies right now. The traditional graduation that we normally have at the Paramount is just not going to be possible this year with social distancing guidelines and some of the directives from the Department of Health. So we're looking at alternative ways to have a graduation ceremony. We definitely want to honor our graduating seniors. A couple possibilities that we're looking at is doing a virtual graduation, which has become kind of popular around the country right now. And that sounds exactly the way it sounds like, you know, doing a lot of things pre-recorded, putting together a lot of videos, and then it would be, you know, the same type of graduation ceremony. It would just be, we wouldn't be live and in person together. Another possibility is a car parade graduation. Some school districts are renting large venues where families can stay in their car, and we can do a graduation ceremony kind of that way. So we're still exploring the possibilities. We'll be talking more about it at our next board meeting on May 19th. Our high school principal, Rodney Arthur, will be there to present about some ideas about graduation. So if you want some more ideas, May 19th, 7 p.m. live stream from the district website. In addition to graduation, we're going to be looking at different ways to honor our seniors this year, our graduating class of 2020. We have a theme going of class of 2020 strong. So be on the lookout around the city and around our schools as we put up displays and banners and lawn signs honoring our graduating seniors this year. You know, unfortunately for those seniors, you know, things like the prom and other items may not be possible this year. And those are great events that people look forward to their entire, you know, academic and their career throughout a school. So we're trying to find ways to definitely honor our seniors. So if anybody has any ideas about doing programs like that, please be on the lookout as we do different programs around the schools. You may see balloons and ribbons and stuff like that. Lastly, the district will be looking at possibly some summer programming. As we understand, you know, 3.5 months of remote learning does not take the place of what goes on inside a classroom and what teachers do. So hopefully, maybe in the summer, we'll be able to have some face-to-face educational programs. If not, we will look at some virtual programs as well. So be on the lookout for some emails and flyers coming out from your building principals about school programs coming up. So, and that's the update from the Peekskill City School District.
Thank you so much, Dan. And thank you for bringing up that it is Teachers Appreciation Week. I think all of us, and you know, for most of us at least, those of us who are not essential workers who are working from home, we're now in this new world of Zoom. But I've kind of watched online. You'll kind of see you'll see what it's like to be a teacher when people post the kind of the parody videos of teachers trying to record themselves teaching or doing a lesson plan or going over a specific subject, and it just having to do that day in and day out, and remote learning is not easy. And the fact that we're expecting our teachers to kind of be able to be so versatile and adapt so quickly, it's a huge undertaking. So I really want to give my deep appreciation to all the teachers out there who are doing all that they can to continue to educate our students in Peekskill and, you know, across the nation. So thank you for that reminder. Do we have any questions from any folks on the phone or folks online? I did have Dan, I did have an idea. Something I saw that I think a school district was doing across the river was they were doing like an Adopt a Senior program where they would publicize, and I think that this was maybe an undertaking that was initiated by parents, where the community had an ability to adopt a senior, and then send letters of support and congratulations to that senior because they're graduating for their graduation. And that might be a nice way to also send some individualized appreciation to seniors now that they won't be able to have a graduation or prom or celebrate in the ways that we've known familiar in years past. But
that sounds like a fantastic idea. I'll definitely put that one on the list. You know, we have another meeting today, and we've been working with our senior class and our student council about coming up with as many ways as we can to try to honor them. So that sounds like a great way to get the community involved.
Great. All right, well, if we don't have any other questions, thanks again, Dan, for hopping on, and thank you for a big thank you to the Peekskill School District for also being one of our agencies that has continued to be on this call week after week. We really appreciate all your updates and all the hard work that you're doing over on your end. But next up, we do have Joyce from our Peekskill Parks Department. Joyce, thank you so much for joining us this morning.
You're welcome, Vanessa, and thank you for having me. I was asked to give an update on our current status and talk a little bit about, the potential for the summer. So I just wanted to let everyone know that unfortunately, our spring programs, we've had to cancel all of our spring programs. We were fortunate to get the majority of our winter programs in. So that's a positive. But it was a tough decision that we had to make, obviously, given the seriousness of this pandemic, and everyone's safety is our utmost concern. In addition to our programs that we had to cancel, we've also put on hold any permits that we normally issue. Rental permits for our riverfront, for special events, pool passes, our Peekskill Stadium. So all of that right now is on hold until further notice. And this, our staff has been working hard the last several month and a half preparing or trying to prepare for our summer programming. Right now we are proceeding because we have to, that there will possibly be camps or pool from an aspect of the health department, because most of our camps and the pool require permits to operate. So we have to complete this process with the health department to be prepared if we are able to have camp or some form of camp. I know in the next several weeks, you know, hard decisions are going to have to be made as far as what our summer will look like. And we are currently looking at programs that we normally offer. Will we be able to offer them in some capacity with respect to our children's shows, our concerts? But, you know, we're going to be held to whatever protocols are put in place with respect to social distancing, large number of gatherings. So a lot of our summer is unknown to us at this point in time. But like I mentioned, we're going to have to make these decisions and really take a look towards the latter part of this month and the beginning of June to really determine and make decisions of what we, you know, may have to cancel, what we can possibly do. And it's tough for us because, you know, this is, from a recreation standpoint, this is what we do. But we have been working with a lot of municipalities, the recreation departments. We're all in the same situation, and we're working collectively to see, you know, how we can offer programs and meet whatever protocols will be in place. So right now I don't have a lot of information as far as what we can offer or what we will be able to offer, but in the next, you know, 2 to 3 weeks, certainly we have to have a better understanding of what we can do or what our parameters are, so what we can try to offer. But it's tough. We have a lot of students that we employ. We typically have anywhere from 175 to 225 summer employees with respect to our camps, pools, and other programs. And then the participants, you know, they've been forced to be home since the middle of March, and now, you know, we don't know what the summer is going to look like. So it's definitely challenging times ahead for us, but, you know, we're going to do what we can and provide as many programs within the parameters that we're given. So right now, I mean, that's really the update that I have. So if there's any questions that anybody has, I will say with respect to our spring programs, we did offer our participants the option of either a full credit or a household, a full refund or a household credit. So, you know, there's been mixed. We have refunded some residents, but others wanted to wait to see what the summer was going to bring and then potentially or possibly use it towards a future program. So, and we've been in contact with our participants. We have about 1,800 households that are registered in our programs. So every couple of weeks, we'll send out just an update that, you know, we don't have a decision yet on the summer. We hope everyone is safe and healthy. So we're just trying to stay in contact that way. So hopefully, you know, we'll be able to provide some type of programming. That's our hope. So I don't know if you have any questions.
Yeah, I do have a question. Thank you, Joyce, for providing those updates. I know we hear a lot about, you know, what we can't do during this COVID-19 pandemic time. So I'm wondering if you could speak a little bit about what folks can still do safely in the worlds of parks and recreation.
Mm-hmm. Well, currently we have our, most of our parks are open, the open space. So we have our riverfront that is highly used. Depew Park is another park that is highly used because we have the tracks and we have the trails. Unfortunately, you know, the playgrounds are another issue in basketball courts. But, you know, certainly getting out onto the fields, practicing social distancing, wearing masks, you know, picking up your mask and gloves off the ground and distributing them to the garbage cans is a big help for us. But just enjoying the outdoors, you know, when the weather obviously allows. And it's been back and forth with, you know, the struggle of Mother Nature with warm days and cold days. But, you know, certainly just getting out and enjoying nature is one, you know, positive thing that our residents can do.
Thank you.
You're welcome.
Do we have any questions?
They're not on Facebook right now. I just want to note, just so folks know that the number of people watching the Facebook Live ranges between 25 and 30, depending on the moment. And so it's nice to know that the panel is being watched live, and also when it's distributed, it's getting clicked on, and the information that the panelists are providing, I think, is very much appreciated. And I just want to put in a plug for bicycling. You know, there's a lot of very active bicycling in Westchester County and in the region. It seems like a good thing to be promoting, and I don't know if Joyce has a comment about that, but there's a lot of opportunity for people, and if we could somehow kind of coordinate and support more bikes for more kids, you know, bike maintenance, the good routes and ways of getting around that are good. I know there's some big hills in Peekskill, so you know, if you go down to the train station, you got to be ready to pedal back up or push your bike or whatever it is. But I think there's an opportunity there to promote COVID-safe recreation in that way as well.
Yeah, I would certainly agree with that, Andy. You know, we would want them to practice safety, helmets, you know, bike where it's proper to bike. You want to be careful of the traffic. And I know that there was a concern on Monday night's meeting with respect to the boardwalk where we have proper signage, but certainly that is an activity that people can participate in.
Right, and it's not that you can't take you can walk your bike over that bridge. It's just so
Yes.
folks know they can continue that path, but you just have to get off your bike, walk it over the bridge, just so we can make sure everyone who's walking over that bridge is kept safe and not being hit. So just for some clarification on that. But thank you, Andy, for putting that plug in. I think that you're absolutely right. I think bicycling is definitely an activity that folks can enjoy right now, given that the weather is so great. And if you know, wear a mask, you know, you can't stress that enough. And folks, it should be part of our regular practice. Anytime we're leaving the house, we should have a mask in our pocket. Yes, Reverend Graham?
Yes, I wanted to ask Joyce, so permits that have already been approved for the riverfront for, say, worship in June or July are on hold?
Yes, they are. We're handling them on a monthly basis. We have reached out to any permit holders for the month of May. And then the last week of May, we wanted to do it on a monthly basis because we didn't know 4 weeks ago what our situation would be today. So that's how we're handling it. So that in the next 2 weeks, we're going to be reaching out to permit holders for June. Fortunately, we don't have that many because we stopped the permit process in mid-March. So anybody who was fortunate to, you know, get in early from January to beginning of March, we have to contact. So there's not that many people, but certainly that will have to be rescinded because of the protocols that are currently in place.
Thank you, Joyce. Do we have any other questions? No? Okay, well, thank you again, Joyce, for all you do, for all your team does over at the Parks Department. And please, as Joyce said, when you're carrying your mask, you're carrying your gloves, don't throw it on the ground. We want to be, you know, it doesn't take It takes very little effort to walk over to a garbage can and toss these things out in the container in which that are meant for that very reason. We want to do everything we can to continue to keep our parks clean and pristine and beautiful for all of us to enjoy, especially as the weather gets better and better. And thank you again, Joyce, for joining us this morning. Next up, we have Reverend Stephanie Graham from the Peekskill Area Pastors Association. Thank you, Reverend Graham, for joining us.
Absolutely. Good morning. Peace and blessings, continued health and safety to all of you. And thank you all for your exemplary leadership, to our teachers and nurses and doctors, and to our local leaders as well. Thank you. The reality of how different gathering for worship safely is going to be is setting in for us. Under the guidance of denominational leaders, we are advised to discontinue a lot of things that people come to church to do or gather in our mosques or our synagogues to do, including communion, fellowship time. We have to be creative as to how we're going to receive our offerings. How we're going to keep our buildings and our bathrooms safe and clean is going to be a financial burden for some of our places of worship. Instead of bulletins, we're going to have to hand out masks and sanitizer or gloves to people who attend worship. We're going to probably continue our Zoom worship services in addition to inviting people to gather in our sanctuaries or our buildings. Most of the people who attend many of our churches actually are the vulnerable persons of age, or they have pre-existing conditions. And I doubt that many of them are going to be returning to some of our places of worship on a regular basis, or at least anytime soon. I am in conversation with our board tonight. I will be, about making our grounds available as a memorial site for persons who are grieving, who have experienced loss, who need a place to mourn and have not had the chance to have ceremony for their loved ones. I will get back with information on that. Pastoral care continues to be a challenge for faith leaders visiting our members who are in nursing homes and hospitals. So we're encouraging people to turn their attention to caring for the families of those persons who are in hospitals or nursing homes. And we're encouraging the public, if you have families who are in nursing homes or hospitals that you cannot visit, that you are concerned about, try reaching out to their faith leaders and ask them to join you in prayer and for encouragement. Talk to their rabbis or whoever might be a member of that congregation, a deacon or an elder, and try to get support that way. We're going to have to rethink gathering for worship completely going forward. And I realize that that's not necessarily a bad thing in all cases, but it is going to be a challenging one for our faith leaders. Graveside services are a possibility for now, with more formal memorial services at a later date. Office hours for most places of worship have changed, so please leave a message on the answering service to identify someone who might officiate a service, a graveside service for you. We're starting an interfaith Zoom prayer gathering. It's going to start on tomorrow for the community, and it'll last for at least 6 weeks, depending upon how it is received. If it's an important service to the community, we will continue to provide it. I'll be picking up flyers from the printer today, and we'll distribute them throughout the community. And we'll have lawn signs available at different places of worship promoting the gathering, especially for next week. The signs are not going to be ready for tomorrow, but we'll make sure that they are available throughout the week. Individual congregations are also sponsoring food share services. I have bags of food in my car that I keep in case of emergency. If someone lets me know, I can drop those off. If you have a need, you can contact any place of worship, ask if they have a food pantry for emergencies, and we'll try to make that available to you. Most of our food pantries are still operative on a smaller scale. We would like to host an outdoor healing service for the community, Spirit Talk, on May the 23rd, but we don't know if we're going to be able to do that in terms of guidelines of when we will reopen. We'd like to provide a place for people to come and share their grief, their concerns, and some kind of memorial so that they can emote and collectively as a community, we can support one another in that way. So we're interested in knowing when the city will give us approval to gather safely. It looks like May the 23rd might not be realistic, but we're looking forward to hosting that as soon as possible. We're also mindful of our clergy who are over 60, particularly persons of color with pre-existing conditions, and how providing leadership could affect their personal health in the immediate future. And we realize that soon it'll be clergy persons who are on the front line, who will be reaching out and providing services to our community. We're called to do that, and we're going to rise to the occasion faithfully, but we're just mindful of those persons who are going to also be putting themselves at risk in order to do so. And I'll entertain any questions that you might have.
Thank you so much, Reverend Graham, and thank you for all your hard work and Papa's hard work in creating this for folks to grieve during this troubling time. I know that it's a hard thing for us, a hard emotion for us to move through. So holding that space the way you are and the way clergy can is truly important. So thank you for providing us with that, and any way in which the city can help and collaborate with you in creating these spaces. I think that that's something that would be of interest for us as well.
Thank you.
Can I just note one thing, that the question of what kinds of events or services are allowed is coming from the governor, kind of through the county. And they're talking about a phased reopening that begins at an unknown date with certain kinds of retail and essential services that progresses through various kinds of businesses. The recreational activities and the other kinds of gatherings that we hold so near and dear are kind of phase 4 in that reopening process. And none of us know right now how that's going to go. It's, in theory, the state is looking at regions, the Hudson Valley, Westchester, and so on. There's a lot of kind of talk about, I think Ben Bolton mentioned this earlier, you know, how Peekskill or Northern Westchester will be grouped in those phases, because the reopening process depends on certain indicators, and it may be that those indicators are gathered at a regional level, and so there's a lot of uncertainty right now on how that will go. And then when we're told that it's okay to permit certain kinds of activities, all of those guidelines and rules for a successful event will need to be the subject of planning by our local groups, and the permitting process too will need to be adjusted. Folks won't just be asked for their insurance, or their other, what date's good for you and what location, but also, what means do you have to make sure that the guidance from the public health authorities is implemented locally. And we'll see that first with the opening, hopefully soon, of the farmers market. And people will see how different it is to have a farmers market operating with these kinds of rules in place than before, when you could just kind of wander in and pick up a couple of apples here and there. It's not going to work that way.
Right.
And so that's really going to be an interesting and challenging process to get through. When we're given the green light, we'll still have a lot of work to do.
Thank you.
Well, thank you.
Does anyone on the phone have any other questions, or do we have any questions from folks online? No. All right. Well, thank you, Reverend Graham, again for joining us this morning. And last but not least, we have our city manager, Andy Stewart, who will be giving us an update, I think particularly on the waiver, the limited waiver that's available to waiver for late penalties on tax payments.
So thank you. The city has taken a couple of different actions to try to provide economic relief. The parameters of those actions are fairly narrow. And in the case of the tax deadline, essentially set by state law, the governor's declaration enabled us to move the deadline for property tax payment, but it's very narrowly defined under state law and the governor's declaration to those who do not pay their property taxes through escrow. Like anybody who has a mortgage, pretty much everybody's got an escrow account and their bank is paying the taxes for them. So those folks don't qualify for the July 15th deadline as opposed to the April 30th. So there's work going on. It doesn't really affect that many people, but that's an example of an accommodation. Other accommodations have included parking enforcement in the downtown area, just to give you a sense of, there's less demand, and the courts were closed, and for other reasons it didn't make sense to be enforcing the meters. So that's happened. The billing, for example, on water bills will be, the deadline is extended, and penalties and interest and whatnot for late payment. So bills that were issued during the period of the emergency will be treated differently. If folks can't make that bill, they won't be penalized. So there's a variety of actions the city has taken to try to find ways to lighten the load on constituents. At the same time, you really have to acknowledge how hard this is for families, for businesses, for churches and other organizations that are seeing all sorts of really hard and tough decisions. And the city is facing similarly as an organization with 250 employees and a broad range of services, which absolutely have to be provided, similar kinds of challenges. A $3.5 million budget shortfall in 2020, and all of the repercussions from that are the focus for our financial planning process right now. So just to give you a little bit of an idea of what happens, for example, the parking meters and fines related to that come in around $60,000 or $70,000 a month, and that's essentially gone to zero. So multiply that out by the duration of this crisis, and you have a sense of the difficulty that the organization faces in funding the things that people need to see. So that's our financial challenge right now. And I mean, there's a lot of other things going on which are important to talk about, but I just wanted to put that on the table just because everybody's more or less in the same boat. In the city, like a household, the revenues have to equal the expenses, and you hope to have a little bit in reserves for a rainy day. And it's kind of the same for all organizations. So that's just a little bit of a framework on that, and an update. I don't want to talk too much right now because we are running up on an hour, and I appreciate the opportunity just to listen to what others have said as well. So thank you.
Thanks, Andy. Are there any questions for our city manager?
I should go back over to Facebook and see what's going on. It's pretty quiet right now. There's about 23 people watching, and nobody's chiming in with questions right now.
All righty. So we are at the end of our agenda. Thanks everyone for joining. For folks who are watching live, thank you for watching and hopefully sharing this video. Do we still have the mayor on the phone?
I think he jumped off. I know that the high school procession is beginning very soon, and a bunch of people are running over to rally.
Alrighty, so we'll go ahead and close up. Thank you all so much for being here with us today. Just a reminder for folks at home to get the most up-to-date updates on actions being taken by the city regarding our COVID-19 response. Please feel free to visit our city website, cityofpeekskill.com. Continue to follow public health guidance, including frequent hand washing and social distancing, continuing to wear a mask as you go out in public to help slow the spread of the virus and enable medical services to meet growing demand. These are really crazy times, and we need to take care of each other. So let's continue to check in, to ask for help when we need the help. The last thing we want to do is suffer alone. We're all here We're all in this together, as many have said on the call, and we'll continue to collaborate and continue to join together to see how we can ease the burden during these troubling times. So a big thank you to all of you for being on this call, for everything you do. And I hope everyone has a great Thursday and the great rest of their week. Have a great day, Peekskill. Thank you.